To my left is Dr. Joff Swain, our Chief Medical Officer here at the Milwaukee Health Department. So today you see the fourth public health, the fourth H1N1 public vaccination clinic that the Milwaukee Health Department has had in the last week or so, really focusing on a subset of the priority, the highest risk for H1N1 disease or complications of disease. This includes healthy children, 2 to 4 years of age, caregivers or household contacts who are healthy of infants under 6 months of age, and then healthcare workers 18 to 49 if they're healthy. They come to the clinic today to receive H1N1 vaccination. It's an intranasal vaccination. We still have not received their allocation of injectable H1N1 vaccine, but we're cautiously optimistic that will be coming in the next couple weeks. As of 2:30 today, we've vaccinated approximately 200 individuals, and so we anticipate a lot more people coming out. The lines are short now, so we urge people to come on out if they meet, again, the subset of one of these high-risk priority groups. Very young children, caregivers, household contacts, and healthcare workers. We're seeing a marked increase in influenza-like illness in our community. We're seeing a high hospitalization in a younger cohort, which is, again, a little disconcerting. Hospitalization is well above what we typically see in a seasonal flu epidemic for people under 65. For a seasonal flu epidemic, we typically see most hospitalizations in persons 65 years of age or higher. As far as Halloween goes, kids should stay safe, stay home if they're sick. Parents should keep their kids home if they're sick for Halloween. Otherwise, enjoy Halloween and stay safe. So now we'll open it up for some questions regarding this clinic.
What is your supply like here of the vaccine? How much do you have to give people?
We have approximately 1,500 doses of the intranasal vaccine still remaining from previous clinics. We've given out 200 doses of those, and again, we're hopefully going to exhaust that supply shortly.
Those are pretty tight parameters that you have?
What's your sense of when that's going to be coming in? I mean, I know that it's an estimate, but what are you hearing and what are you hoping for?
Yeah, I'm hoping that by mid to late November we'll have a majority of our allocation of vaccine that we could distribute to the general public.
This is the last one for at least a couple weeks?
We think at least for this week and possibly next week, correct.
Those are pretty tight parameters that you have. Are you turning people away who don't fit those parameters? Children 2 to 4, caregivers of infants under 6 months?
Actually, we haven't turned any people away at all, and we will vaccinate people that are eligible for the intranasal. But let me turn it over to Dr. Swain, and maybe he can, again, clarify who is eligible and turn away from this vaccine.
All right, so I'm Dr. Swain, Milwaukee Health Department and the University of Wisconsin School of Medicine and Public Health. It's important to make a distinction between who can normally get the nasal vaccine, which is any healthy person aged 2 to 49, and the higher risk parameters that Paul Biedrzycki just mentioned. The reason that we're focusing on that much tighter group of people right now who are at the highest risk is because of the short supply of vaccine right now. Certainly once vaccine becomes more widely available, we would be giving and encouraging everyone in that healthy 2 to 49-year-old group to get the nasal vaccine, and when injectable becomes available, then that's people aged 6 months and up.
We've had a number of people who have left here today. They were pregnant or they had asthma and were disappointed they couldn't get that injectable. What would you say to those folks? What kind of risk are they under until you get some of that available here?
Well, I think it is very important for the high-risk groups who are not eligible for the nasal vaccine to get vaccinated as soon as they can. As Paul mentioned, we do have a lot of disease circulating in the community right now, a lot of this H1N1 influenza. At the same time, it's not the case that suddenly everybody in Milwaukee gets ill all at once. So I think that people who need to be vaccinated, who are in the high-risk groups and who can't access vaccine right now because there's no injectable available yet, need to just do every other thing that they can to stay healthy. These are the things that we've been harping on consistently since this outbreak began. Frequent hand washing, covering your nose and mouth when you cough, certainly not going to work or school if you're feeling ill with fever and cough or sore throat, and I would say for those people at high risk, do your best to try to stay away from ill people. But for the general public, I think it's really important to keep in mind there are people right now in the community who are at high risk who cannot get vaccinated because there's no vaccine. So it's up to all of us to protect those people by staying home from work or school if you're feeling sick.
Other questions we have regarding the clinic or
Any frustrations, Paul? Any frustration with folks who have gotten and are getting the vaccine but do not fall into the specific parameters, either the general parameters or the specific parameters? Does that bother you guys at all?
It's a little frustrating, certainly, not to have the allocation of vaccine given the demand by the public. Again, we're cautiously optimistic that in a few weeks we'll be getting large allocations of injectable and additional intranasal to provide not only to the target groups, but also to the general public as well. It's a little frustrating. The public's been tremendously patient and tolerant.
I think one of the things he was getting at, though, is what would you say to someone who does not fall into those very strict parameters of 2 to 4, parent of someone under 6 months who's healthy and coming here for the vaccine, for the mist?
Again, to observe other types of, again, interventions, including good hand washing, good cough etiquette, stay home if you're sick, seek medical care if you have severe symptoms or if symptoms worsen, and then again, be patient. Vaccine is on the way. It'll be available not only through these public vaccination clinics, but through private healthcare providers.
But those
as well.
folks who are healthy should not come to this clinic.
Again, people
what you're
that do
saying?
not meet the priority groups, again, we're asking you to defer vaccination at this time.
Seems like the nasal aspect of it all is kind of petered out. How big of a rush do you expect when you do get the injectables?
I do expect there'll be quite a bit of demand for the injectable vaccine because many of the public that could not avail themselves to the intranasal certainly will be interested in receiving the injectable, and that's a good portion of the high-risk groups that we initially want to target, including pregnant women and individuals with chronic underlying illness after 65. Mid to late November for a majority of the public, hopefully in a couple of weeks. Dr.
I would just like to add to that I don't think we have yet gotten close to vaccinating everyone who is eligible for the nasal vaccine. So your comment that the demand is petering out, I'm not sure that that's entirely true yet. I think there's plenty of other folks that would be eligible for the nasal vaccine. And right now we're keeping these parameters very tight because we don't have a lot of nasal vaccine. When more is available and we open the parameters up to everyone who's healthy, age 2 to 49, I think you'll see quite a bit more demand.
So as long as you have this certain amount of supply, you will stay with the parameters that you have?
Absolutely. Again, this is a limited supply of vaccine, and again, we want to focus on the priority groups, and in particular the subset of the priority groups, these very young children that are high risk. We're seeing a majority of infection and hospitalizations in that age group. This is a young person's flu, as opposed to seasonal influenza, when we see a majority of severe disease and death in people 65 and above. So yeah, this is going to be a very critical period.
When you talk about that hospitalization, do most of these younger people entering the hospital have pre-existing conditions that would make them more susceptible, or are these young, healthy people who are being put into the hospital with the H1N1 virus?
Well, locally, we're seeing both, actually. Nationally, they are seeing an increase in individuals that are healthy young children succumbing to severe consequences of H1N1 infection, unfortunately. And I don't know, Dr. Swain, do you want to add to that? No? So if there's no other questions, we'll have additional updates as vaccine is made available or further information is forthcoming. Thank you.
Thank you.
And we'll try to notify you as